Welcome to Kenton Teaches. Enjoy the video.
You start by confirming the correct Mounjaro pen and dose. This matters because dosing errors cause harm. Once confirmed, wash your hands and position supplies within reach. Remove the cap, attach a new needle securely, and perform a 2-unit air shot to prime. Tap the cartridge gently, dial 2, push until a drop appears. Make sure the liquid is clear and the label matches your prescription before moving to injection. Now you set the prescribed dose by turning the dose knob until the number aligns with the window. Double-check it visually. Choose your injection site and clean with an alcohol swab. Wait until dry. Pinch a fold of skin if thin, insert the needle quickly at the recommended angle, and press the injection button fully. Hold it for 5 to 10 seconds to ensure full delivery. Release, withdraw, and inspect the needle for blood before recapping safely. Finish by replacing the pen cap and removing the needle straight off into an approved sharps container. Do not reuse needles. Store the pen per instructions, refrigerate unopened pens, and track the in-use time frame on the label. If you miss a dose, inject as soon as remembered within your guidance window. If pain, persistent redness, or no expected effect occurs, contact your clinician with the pen lot and dose information. Troubleshooting tip: if the pen fails to deliver, repeat priming once and document the attempt.
Thanks for watching. Please subscribe if this video was helpful.